Welcome to a Prevent Connect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
So today we have Glorina Stallworth from the North Carolina Division of Public Health. She's the Rape Prevention and Education Program Manager. And this workshop, if you're here for thinking outside the box, injury-free academies as a vehicle for sexual violence prevention, then you're in the right spot. You are? Great. Okay. Thanks.
Well, good morning, everyone. So I was telling Mo a few moments ago, it's always good. I like having a smaller group because we can do some interaction and have a discussion and a conversation if that works for you all. So just to tell you a little bit about myself, I've been the RPE program manager for about 3.5 years with the Division of Public Health. Prior to that, for almost 6 years, I was the Family Violence Prevention Coordinator, so FIPSA, if you know anything about that. And prior to that, a year before that, I was the TANF-DV consultant, way back when we had, yay, TANF-DV, which is now gone away. But, so people say you have a thing for violence, right? I guess I do. But, as you know, once you're in this field, you love it. It's like one big circle, it's like one big family. And so I love what I do. A lot of times I feel like, we feel like we push paper and we really wonder if it's making a difference, but it is. And when you come to settings like this, you really see, wow, it's great to meet other people who have the same interests. This session is about collaboration, and it's about meeting new people, and most of all, it's about bringing people into our circle. And they may or may not be individuals who have been doing this work as long as we've been doing it, but it's about engaging your community. And so, as you know, the title of this session is Using Injury-Free Academies as a vehicle for sexual violence prevention. So we're going to talk a little bit about those injury-free academies, but I have a cartoon that you can see that says, we like to bring together people from radically different fields and wait for the friction to produce heat, light, and magic. And sometimes it takes a while. And so as you see, you've got people shooting airplanes, paper planes, somebody sitting over in the corner. It's natural that we have our agendas. And sexual violence prevention is something that many times you have to engage those non-traditional partners to have those hard conversations, to talk about what do we need to do to eradicate this from our community. North Carolina, in 2009, created a strategic plan. And in that strategic plan, each branch, the injury and violence prevention branch, was tasked with coming up with goals and objectives for various public health priorities. And the goal for 2009 was develop a statewide injury and violence prevention workforce that meets core injury and violence prevention competencies. And in 2012, they decided to come back and say, well, what can we do to really address the issue of violence? And in working with the Injury Prevention Center at the University of North Carolina, Chapel Hill, they came up with, let's come up with injury-free academies. These are academies that we will use twice a year to address different issues and bring together teams from across the state. And so hence they were born. They decided to establish these annual academies for professionals to enhance their knowledge and practice of injury prevention. It's based on preventing violence through education, networking, and technical assistance. This was a model established by Dr. Carol Runyon. And the emphasis was team-based action learning, immediate application of curriculum to team project, coaching, and it was a national training initiative on the core competencies in injury prevention. It's multi-organizational, multidisciplinary county teams currently working already on a problem. So an application was literally created, sent out to different networks. First of all, what they did was a needs assessment. and said, what are the needs in the community? So they pulled together college universities, not just UNC Chapel Hill. They pulled together rape crisis centers, high schools, various people in the communities, and said, some of the other community-based organizations, what are the needs? What do you think about sexual violence prevention? Do you think it exists in your community? How would you address it? Based on the data from those needs assessments, that's where they were able to develop and start creating the Injury-Free Academies. There are 2 in-person sessions that are made up of coaching, technical assistance, and typically we do them every 6 months. And of course, as we've said before, they focus on various priorities. The team members, well, I see the T got cut off, but you've got local public health department staff, social workers, educators, other school personnel, law enforcement, mental health professionals, attorneys. The counties that are accepted can comprise, the teams can be comprised of various members in the community. So we don't care if they bring on guidance counselors, teachers, community advocates, community activists, people from the hospitals. But the teams are made up of 5 to 6 individuals. And the application was created, so the way that it works, the application was literally created by UNC Chapel Hill. And once it's sent out on the listservs, these individuals can tell us who they anticipate having on their team, and then share a little bit about what is the need in your community. How do you plan to address that need? So I don't know, I'm sure there are many of you who have local task forces. So in essence, these are task forces that come together. What we found is that after the academies are over, people keep working together. Because why? You've started that conversation. And so some of the benefits of the Injury-Free Academies, and we'll talk a little bit more about what literally happens once they come together. Some of their needs are identified. We do initially a pretest, because we want to see where everyone is as it relates to violence prevention. Team building activities. We also talk about the public health approach to prevention, epidemiology. We provide grant writing workshops. And these grant writing workshops are conducted by state personnel, contractor agencies, and some of our agencies who are community-based organizations. So if this is something that you model and take back to your counties, you can use individuals that don't have to be from state government. You know, we're the ones that give the funding to UNC Chapel Hill to do it, but you can use anyone you want to do these workshops. And the thing about Injury-Free Academies, we found that we can tailor them depending on what the priority is. So for sexual violence prevention, we wanted to do grant writing because why? Funding is what we all need for what we do. So we wanted to be able to share some key points to writing successful grants. The other item that we thought was very important when it came down to the Injury-Free Academies, especially with those RPE teams, and I'll talk about that, is a funders panel. So as funders, if you all don't mind, I'll just kind of walk around a little bit. As funders with, and I don't know if they can still hear me or not, but as a funder with the Division of Public Health, I wanted to pull together the Governor's Crime Commission, the North Carolina Council for Women, other funders who could come and share a little bit about what is part of the grant process, what are some things that they can do to get additional funding. There were agencies there that had no idea about RPE. And so it gave them an opportunity to hear a little bit about my program so that the next time we have a funding opportunity, they realize, oh, I can actually apply for this money. So that's the benefit to having a funders panel. The other thing is we talked about sustainability. So what happens if funding goes away? That's an item that I push quite a bit with my RPE grantees. North Carolina wants this work to be sustainable. So if the CDC, heaven forbid, decides that we're not going to get the money, what are you doing in your community as a team of individuals to ensure that this work is sustainable? What are you doing to help your community take ownership of sexual violence? The state of evidence and best practices, we talked about various evidence-based strategies those that we were using in North Carolina, we primarily use Shifting Boundaries and some other homegrown programs, but we wanted to present a menu of options so that these RPE grantees and some of the other teams have some kind of knowledge of what's out there. We talked about project planning and evaluation, coalition building. There were team presentations. Each team at the end of this 2-day workshop is required to do a presentation about their plan. They develop at least a 1 or 2 year plan, and they are required to present that. Many of them use a logic model that they develop. The sessions go from 8:30 to 5 o'clock for 2 whole days. It's very, very intensive. You're sitting with your team. We typically have 5 to 6 teams of 5 to 6 individuals. And you really talk about, okay, what are some of the risk and protective factors as it relates to the work that we all do? The key is finding that common ground. And you know what we saw as we did these sessions, we saw that people started really realizing how pervasive this problem was. And people started saying, wow, we had school teachers, educators who came and said, I just had no idea it was that bad in high schools or in the middle school. I've been a teacher for 20 years. And a lot of times they would often get people who they had maybe met through doing sessions. 90% of the work that my grantees do is in the schools. So they're in middle and high schools, and then we fund 2 universities, the University of North Carolina, Chapel Hill, the University of North Carolina in Greensboro. And so a lot of them said, let's go and get these school teachers, let's go and get guidance counselors. And let's let them come in and have an opportunity to really talk to us and see what we can do. One of the neat things that was birthed out of the RPE, Injury Free Academy, is that Asheville, my agency in Asheville, North Carolina, Our Voice, literally started working with the Girl Scouts. So they're doing primary prevention with Girl Scouts. And what happens? A lot of this is just from talking to people. They're doing backpack buddies, where they're going out and they're working now with Boy Scouts, and they're getting boys who are the ages 11 to 13, and one weekend out of every month, they're going out talking to them about primary prevention. And they're using backpacks to actually put primary prevention materials in these backpacks and sit out and camp with them on the weekends. So there are a lot of activities that have been birthed just out of coming together for these 2 days. We also do a post-test evaluation, because afterwards we want to see what has happened over the past 2 days, what has been learned, what are some next steps. So we have coaches and facilitation. So the coaches are highly experienced in coaching and project planning, implementation, and evaluation. Of course, we naturally use our subject matter experts. For the Injury Free Academy that we did in 2015 with the RPE grantees, it was primarily for sexual violence prevention and child maltreatment. So our experts was Prevent Child Abuse North Carolina and the North Carolina Coalition Against Sexual Assault. So naturally we use them as coaches. I was a coach, as well as individuals from UNC Chapel Hill. So again, if this is something you want to model and take back to your counties, you can utilize those individuals who are well-versed in the field. And they don't necessarily, again, have to be state personnel. Use your partners. NC CASA, we have a training and technical assistance contract with them. So many of you that know Jen Shavaznik, we literally give them quite a bit of money to be the experts in our state, not just with our grantees, but with all of the 76 rape crisis centers in North Carolina. And so we lean heavily on them as the experts to take this work to the next level. Our coaches and facilitators generally share 2 teams. Because we have 6 teams, most of them have 2. We normally have 3 to 4 coaches, and they provide this throughout the in-person sessions. There are also monthly coaching and facilitation calls. So between the 6 months, For the RPE grantees, we did it in January 2015, and we came back in May 2015. So between those 4 months, give or take a few months, between that time, we use that as an opportunity to do check-in calls to see, where are you? Have you met with your team? Many of them were creating logic models. So here's the advantage to RPE grantees. They were able to fulfill some of their deliverables for the contract they had with us. So they were able to do logic models, they were able to work on their scope of work and make it more robust. So by the time they left, they actually had some products that they could use. And then there are resource suggestions and models that we provide. So here's a little bit about the Injury-Free Academy. So the very first one was done on teen driver safety. And there were 4 teams, there were 17 participants. That was the first time it was launched. And so we wanted to kind of get a feel for if this was something that was going to work. But we found afterwards Pitt County kept it going. Pitt County, which is Greenville, North Carolina, and the team that they created, the teen driver safety team, out of that, they took it back to Pitt County and continued to do trainings, which naturally assisted them with this. And so what the new thing that we're starting to do with the Injury-Free Academies, so we're starting to put more of a robust evaluation component with it to see down the road. So how is this sticking with the communities? How is this working? What changes are we really seeing long term? 2013, 2014, we did prescription drug overdose prevention. And there were 10 teams. This was the largest one. North Carolina is a leader in prescription drug overdose prevention, but at the time, in 2013 and 14, that was the hot topic for public health, as a public health priority. So we had 10 teams with 43 participants. 2015, of course, we did the Creating Communities That Are Free of Sexual Abuse and Sexual Violence, and this is where we had 6 teams, 25 participants, which we thought was a really good amount when you think about it for sexual violence. It had never been talked about. Just to be transparent with North Carolina, with the Division of Public Health, a lot of times we weren't at the table. So when there were discussions, when there were communities of practice, people would say, oh, and that's right, what do you do? Sexual violence prevention. So this also was a launching pad for us and gave us an opportunity to have the conversation. And so now what I noticed after we did the Injury-Free Academy, people are inviting us more to the table. We are beginning to do work with the chronic disease and injury section as a whole. So I'll be working with tobacco control, heart disease and stroke prevention. Why? Because people said, oh, we didn't realize just really how big of an issue it was. And also, we did not realize those shared risk and protective factors. So 2015-16, we just finished this academy the beginning of this year. There were 2 sessions, and this was on suicide prevention. There were 5 teams and 30 participants. So some of the critical partnerships for the 2015 Injury-Free Academy that focused on sexual violence was, of course, naturally, our branch, our experts, the Coalition Against Sexual Assault, and then the Centers for Childhood Maltreatment, and PCA. These were intricate partners. Some of the learning objectives. So describe the epidemiology of sexual assault and sexual violence and the state of the problem within the area addressed by your coalition and in North Carolina. We wanted to be able to articulate the public health approach to prevention and apply these concepts to the work along with the shared risk and protective factors. We wanted to be able to explain the state of the evidence on preventing SA and SV, and then identify how some of our selected prevention strategies have worked and can be adopted and adapted to new settings. We also wanted the participants from the academies to be able to demonstrate basic skills in planning and evaluating prevention efforts. And then we wanted them to also be able to articulate the challenges and some of their successes in building and sustaining these coalitions. One of the requirements of all of the RPE grantees, so we have 9 in North Carolina. So 4 of the teams were current RPE grantees. One of the requirements is to maintain a local task force. And so some of them that came had just started receiving our funding, and so they were still trying to build their task forces. This gave them an opportunity to get some individuals who are now a part of those task forces. And it gave them an opportunity to go on and build on that. So out of that, they were able to get their task forces, they were able to create their logic models, and then these were also champions, many of them, to take this work back to the community. Also, we wanted them to identify and begin working with a network of colleagues among the Academy participants, instructors, facilitators, and coaches. Some of the testimonials from the Academies, and these were actual statements. People said, oh, this is a great opportunity. I look forward to future training. I thought it was very insightful. It was information-packed, and it can be very, very useful. There's a high value placed on hearing from other teams. And someone said it's not so great because they feel like it was rushed and that it was too much packed in. Because we only have 2 days that we can pull professionals away from their work, so we made it a power-packed, like 2 days, if you will. And some of the lessons learned and the successes were the coaching and facilitation is necessary. You can't bring teams together from your communities and not have coaches who are experts in this field work with them and do hands-on. It was organic group discussion. So, people it kind of morphed into a whole lot more as far as relationships. And just from putting these people together, we had law enforcement who said, I don't know a lot about it. I know we get calls. I work in this unit, so I want to, I just said I would come and be a part of it. And we saw that it morphed into so much more. Community partners, we found, are essential in successful injury-free academies. Interactive sessions. So we had, not only did we begin with general sessions, we had breakout sessions throughout the day. And then, of course, we had working lunch panels. Some of the successes, of course, naturally was the coalition building. Many of the attendees reported an increase in knowledge, especially those who were not grantees. The local RPE were able to maintain their community plans and utilize their logic models as it related to this work. It also caused increased policy work on the local and state levels. So the sustainability of injury-free academies. Well, there's no funding source to maintain this work. It's just a matter of the agencies taking it back, with the exception of those RPE programs. So the way that we have been sustaining this work is we utilized core funding. And also we used, I don't know, those of you who may have the public health block grant, so we were able to use some of the RAPE set-aside money to take care of that and to pay our coaches and facilitators. So that's where we get the funding from, and we're actively looking. So what's happening now, UNC Chapel Hill is actually looking for ways to have the injury-free academies totally funded over the next several years, because we found that it's very valuable in our state. And so versus pulling funding from other grants, we want to be able to just write it into a grant and know that it's going to be funded each year. So coming soon, so next year, we are going to do our Injury-Free Academy on shared risk and protective factors. And we also have a PreventViolenceNC.org website that was just created by the North Carolina Coalition Against DV, and we were partners with that. And so if you go out there, like I said, it's PreventViolenceNC.org. It shares a whole lot about not only the shared risk and protective factors, but the work that we're doing as a state as it relates to intimate partner violence, sexual violence, and just the cross-section of work that we're doing. So I would encourage everyone to go out there and just take a look. We're also going to be doing one of the other things that was morphed from our injury-free academies. We're doing a prevention summit for hopefully anywhere from 150 to 200 individuals in November in conjunction with NC CASA. And the way that it came about is that from these sessions, people said, we need a little bit more time. We need more sessions to be able to talk about this work as it relates to sexual violence prevention. And so November 9th and 10th, we'll be doing this at one of the hotels there in downtown Raleigh.
Thank you for listening to this Prevent Connect podcast. Prevent Connect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on Prevent Connect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about Prevent Connect, visit www.preventconnect.org. For more information about CalCASA's mission, or to show your support, visit calcasa.org. That's CalCasa.org.